What about size of implant? Well, this is an area where people get really confused. In truth, there's absolutely no substitute for having a consultation with an expert surgeon, telling them or showing them in photographs what you want to achieve. The surgeon examines you and tells you what's possible for you. Then you'll try on a range of different sizes and shapes of implants and different profiles, in a crop top and perhaps in your own clothes as well, looking in a full-length mirror to see what it looks like. You may be surprised, because a lot of patients who come to see me say, oh, well, I think I want to have, for example, a 300cc implant because that's what my friend's got, or I've seen photographs on Google of 300cc implants and it looks about what I want to have. Well, that doesn't work, because if you put a 300cc implant in 10 different women, they will all look different and many of them will have different cup sizes. Because the final result is a combination of the implant and your breast tissue on your chest wall, because that's a unique combination and you have to have a unique operative plan for you to get the best result you can possibly get. So don't make the mistake of comparing your size with other people. Your friend might have 300cc implants, but you won't look like that if you have 300cc implants. Don't look on Google for 300cc, 400cc implants, whatever it is, and say, oh yes, I like that, so that's what I need to have. It won't work. You have to have a consultation with an expert and try the implants on after you've been measured to make sure that they're going to fit you. If you've had a consultation, you've decided to have breast implants and you go away, often what happens is patients will, in their dreams, they'll wake up in the middle of the night and they'll think, oh blimey, it's going to be too big or it's going to be too small. Then they'll go and talk to their friends and they'll look on the internet. Don't do it. Come back for another consultation and a resize. It's much, much better to do that, because any other method of doing it is a poor substitute and likely to result in you choosing the wrong size. One other thing that I'll say about size is, if you get stuck between two sizes, you're not sure, should I have the 280cc implant or should I have the 310cc implant? As a general rule, if you're stuck in the consultation, you're not sure which one to go for, I would suggest you go for the larger one. Because what happens is, after the surgery, the breasts are a little bit swollen. And patients get used to that. And when the swelling goes away, sometimes they realise that they prefer the slightly bigger size. So if patients have a regret about size, it's nearly always that they went a little bit too small rather than they went a little bit too big. So if you're stuck between the two sizes, probably better to err on the side of going larger rather than smaller. And remember, there's only going to be about 30 mils. That's a shot glass between one size and the next. So if you do get it wrong, you're only going to be a little bit wrong.